This is TTT Live. I'm DK Rossar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to Candice Alcantara, Corporate Communications Manager at the Ministry of Health.
A pleasant good morning and welcome to the Ministry of Health's virtual media conference, which provides an update on the Ministry's COVID-19 response. With us today are the Honorable Terence Dayal Singh, Minister of Health, Dr. Miriam Abdul-Richards, Principal Medical Officer Institutions, and Dr. Avery Hines, Director of the Epidemiology Division. I'm Candice Alcantara, Manager Corporate Communication at the Ministry, your moderator this morning. And we begin with the opening remarks from the Honorable Minister.
Thank you very much, Candice. Good morning to you. Good morning to Dr. Richards on my left.
Yalla.
Just a word of caution, Dr. Richards doesn't get much sleep, because she's in charge of all these repatriation flights that come in all weird hours of the morning. So it's nice to see you here this morning. Also, good morning to Dr. Hines. Good morning to ladies and gentlemen of the media and the viewing and listening public. It's been a while since I have contextualized what we in Trinidad and Tobago are facing in terms of where we are globally. I always like to give the global context so we could understand what our figures mean, we could understand and appreciate our public health measures and what they have done for the country in saving lives and livelihoods. There are many metrics that we could use to measure how well we are doing in Trinidad or how well we may think we are not doing. What are some of the metrics globally that we tend to look at? One of the figures that I started to give the public on the 24th of October last year, 24th of October 2020, was the number of countries that have recorded 1 million cases and over. And I started to do this to alert the population that this global pandemic is not slowing down, it's not going away. And yes, we have COVID fatigue. So on the 24th of October 2020, there were 7 countries that recorded 1 million cases and over. Today is the 13th of January 2021, a mere 2.5 months later. The number of countries with 1 million cases and over is now a staggering 18. So we have moved from 7 countries with 1 million cases to 18 countries with over 1 million cases from the 24th of October to the 13th of January. And I always try to give some perspective of what we could expect with this metric. There are 3 countries that are registering over 800,000 cases. 3 countries. So by the next time I give this type of update, it will have moved from 7 to 18 to possibly 21. I know people around the world and Trinidad and Tobago are fatigued, are tired. I know that. I am tired. We are all humans. We want life to go back to how it was a year ago. But in the Trinidad and Tobago context, our numbers have been very steady from October to now. And the steadiness of those numbers speak to the majority of the population and businesses who are willing to endure some hardship to protect lives and livelihoods. I want to continue to thank those members of the business community who are affected, especially restaurants, nightclubs, casinos. You are affected, we know that. And I want to thank all of you who have been working with the government and complying with the public health measures, especially your 50% capacity. I want to thank you. I also want to thank those members of the public who have been internalizing the messages and those members who are behaving in a very responsible manner. I want to thank you this morning. And again, I always want to thank the media for carrying the messages. But in doing that, we must be cognizant of the fact that COVID fatigue does not mean that the virus is tired. The COVID virus is not fatigued. It is not tired. Why? Because to date, the daily number of new cases being diagnosed around the world is now over 750,000 cases per day. The last time I would have given you that statistic, it was between 650 to 700,000 cases. It is going up. The total daily number of deaths is now a staggering 15,000 per day. Per day. And the total number of deaths globally is 1,973,720. Think about it this way. Because sometimes figures by themselves have no impact. You need a comparator. 1.9 people have died around the world. The population of Trinidad and Tobago is 1.4. Let that sink in for a while. It means that the global death rate is more now than the population. It's like the whole population of Trinidad and Tobago has been wiped off the face of the earth. Think about it in that type of comparison. And to date, there are 92,164,024 cases around the world. So the simple message before I close is that whilst Trinidad and Tobago can celebrate in its steady numbers since October, our fatalities have come down significantly. We are still in the midst of a global pandemic. And if we are to have a better 2021, which I know we can have, and hopefully we can do that by adhering to the public health measures, it means that we can't be tired. We can't be weary. We have to keep up the public health measures, and let me just reiterate them. They are so simple. They may be slightly inconvenient at times. Social distancing, wearing your mask. You see this? Think about this as a piece of medical equipment now. Think about this simple cloth mask as a piece of medical equipment that could save your life. Think about this as an ICU unit that could save your life. This simple mask, the social distancing, the wearing of your masks, the hand sanitizing, stay home if you are ill, and most importantly now, at this time, no large gatherings. Although the public health measures speak to no gatherings in the public domain, as I have said earlier in press conferences, that is the letter of the law. But the spirit of the law also means how you conduct your business in your private settings, in your homes. Please, to protect our elderly, our school children, and to protect our economy, and to protect businesses, please refrain from having home gatherings at this point in time, and these simple public health measures will, in fact, make us have a very bright and better 2021 that we did have in 2020. Thank you very much for listening to me over the past few minutes, and Ms. Alcantara, back over to you.
Thank you very much, Minister, for those words of encouragement. We have a long way to go, but we've come a long way already together. And now we go to Dr. Abdul Richards, who will provide the clinical update and some information on the repatriation process.
Thank you ever so much, Ms. Alcantara. Good morning, Honorable Minister, and to my colleague, Dr. Hines. Good morning to distinguished members of the media. Thank you for always being here and for keeping interested and up to date on the Ministry of Health and the government's national response to the COVID-19 pandemic. Good morning, Trinidad and Tobago. This morning, we are placing focus and emphasis on two main focal points, which are an update on our parallel healthcare system and the ongoing status of the repatriation exercises for returning nationals. Ladies and gentlemen, it will be remiss of me if I did not pause for a moment to recognize the frontline persons who continue to provide selfless service to Trinidad and Tobago in this national response. I recognize all of our healthcare workers, not only at the hospitals, but those who are employed at the ports and administrative offices of the Ministry of Health, the staff of the Ministry of National Security, again, administrative officers who process applications for repatriations, the Trinidad and Tobago Defense Force, the Trinidad and Tobago Police Service, the Immigration Department, and the prisons. We also would like to recognize the contribution of the Customs Department and the Ministry of Foreign Affairs in the repatriation effort, as well as medical personnel attached to the energy sector and to the diplomatic community. Lastly, I would like to recognize hoteliers and private service providers who have provided incredible support throughout this exercise. At this point, I would like to provide a clinical update on our parallel healthcare system as of 4 p.m. on the 12th of January 2021. At present, there are 25 confirmed COVID cases distributed at 3 of the 7 hospitals earmarked in the parallel healthcare facility. At the Couva Medical and Multi-Training Facility, there are 17 patients. At the Cora Hospital, there are 4 patients. And at the Scarborough Regional Hospital at the Fort, there are additional 4 patients. Of these 25 patients, 3 persons are hospitalized at the ICU of the Couva Medical and Multi-Training Facility. It is noteworthy to identify that the occupancies at hospitals in the parallel healthcare system over the past 12 weeks or so has been overall between 8% and 16%. Additionally, ICU rates or ICU occupancy rates have been between 4% and 18% with a downward trend noted, while high dependency rates span between 0% and 16%, again with a downward trend noted generally over the last 12 weeks. These statistics demonstrate the resilience and adaptability of the parallel healthcare system. At our step-down facilities, we currently have 11 patients. At Debe, there are 3 patients, and at the Tobago step-down facility, at Debe there are 8 patients and 3 patients at the Tobago step-down facility. As per patients in the state quarantine facilities, there are 386 patients who are distributed between 10 state and state-supervised facilities, and these persons essentially are repatriated nationals from Barbados, New York City, Canada, the UK, and Miami. Over the past 24 hours, there were 13 positive cases that were identified, of which 1 case was in Tobago and 2 are recently repatriated nationals. At present, we had an unfortunate death within the last 24 hours since our last update of an elderly male with comorbidities. And again, we would like to express our sincere condolences to the families of all deceased persons and that of the newly deceased. I would like to focus now on the repatriation exercises that have been ongoing. Firstly, the authorization or approval for exemptions to enter Trinidad and Tobago fall under the purview of the Honorable Minister of National Security and the Ministry of National Security. The Ministry of Health works in collaboration with the Ministry of National Security in providing logistical arrangements as well as quarantine arrangements once persons enter Trinidad and Tobago. We have 3 repatriation exercises that are carded over the next 10 days. Generally, we approve, or the Ministry of National Security does approximately 130 approvals for exemptions for persons that are returning nationals. On the 14th of January, there's a repatriation exercise for persons from New York City. On the 16th, a similar exercise from Barbados, and on the 23rd, an exercise from Canada. At this stage, I would like to thank the population and returning nationals for their patience and understanding as we try to keep our country safe and their adherence to COVID-19 protocols as per government policy. Now, in spite of the government of Trinidad and Tobago's comprehensive and overall successful implementation of policies and plans, of course led by the Honourable Prime Minister, the Honourable Minister of Health, Minister of National Security, and our Chief Medical Officer, we need to keep safe in managing this global pandemic. Let us not take our initial successes for granted. Let us be respectful and cognizant and mindful of our personal responsibility and adhere to COVID-19 measures, which were just explained and clearly described by the Honourable Minister of Health. Let us work together and exercise personal responsibility to keep our families, our neighbours, our co-workers, and Trinidad and Tobago safe. Thank you so much for this opportunity to provide these updates.
Thank you very much, Dr. Richards. And next we go to Dr. Avery Hines, and he will give us some information on the impact of gatherings on the spread of COVID-19. We go to Dr. Hines.
Thank you, Ms. Alcantara. Good morning to the Minister, to my colleague, Dr. Richards, to the members of the media, members of the viewing and listening public. Today, I'd like to do two things. One is to sort of continue the update that we were giving on the current local trends, and then look at the impact or the potential impact of gatherings using some international evidence. So between the last update and now, you'd have seen that we saw on Monday 8 additional cases, on Tuesday 13 additional cases, and this is on the heels of seeing slightly larger numbers on the weekend, 25 and 21 on Saturday and Sunday respectively. Now, as we were aware, the figures that we generate coming out of the laboratory testing reflect cases that would have presented to the hospitals and had their tests done within the previous 24 to 48 hours. So the cases, the numbers that we saw on Saturday and Sunday would have been reflective to some extent of the testing behaviors driven on the Thursday and Friday. And as we alluded to, that Thursday and Friday, so it fell right on schedule at the 2-week mark after our Christmas festivities, leading the statement to be made that we're hoping that we have not begun to see the establishment of an upward trend because of any activities that may have taken place during the Christmas festivities. We are happy to see slightly smaller numbers on Monday and Tuesday, but those may just be reflective of the test-seeking behavior that drops over the weekend, and we'd be continuing to monitor and to keep the population updated as we get additional information. Today's figures will be instructive, as will the figures for the remainder of the week, bearing also in mind that another key celebration point is now approximately 2 weeks into the past, that being New Year's Day. So the combination of whatever behaviors may have taken place on Christmas Day and New Year's Day and in the intervening days will be the drivers of whatever figures we're seeing now. As I said before, we do hope that we are not seeing an establishment of a rising trend. But as we say that, we do need to circle back to the behaviors that we've been asking people to avoid and the reasons for that avoidance. We're going to step outside of the local context and look at just 2 large-scale events that gave some clinical and epidemiological evidence that is irrefutable with respect to the effect of gatherings. We would remember that there were protests in the United States as a result of police brutality cases around the George Floyd incident. There's actually a paper now published in the medical literature that has confirmed what we thought generally would happen, but it has confirmed that there was an excess in COVID-19 cases in each of the cities where those protests would have taken place. This is after having done specific examination of trends before and after the protests, They have confirmed what we already knew and what we've been seeing, but now it's documented in the medical literature, that that sort of outdoor gathering, although it's outdoor, although there's fresh air, once people pull themselves together, shout, raise their voices, don't have masks on, we see that documented concrete evidence of increases in COVID-19 cases subsequent to that sort of event. Another good indicator was actually the trend of daily cases in the country of Argentina. As we would remember, the legendary footballer Diego Maradona passed on, and his funeral service was at the end of November. At that point in time, if you looked at the daily cases, and you can go check it for yourself, if you looked at the daily cases in Argentina, the daily cases were on a downward trend for a steady period of time, and they turned right around and started going back up in December. The entire direction of the epidemic changed subsequent to that. That mass gathering that accompanied the mourning period, that extended funeral period, lots of people gathering, again, close contact, no masks. That behavior drove a documented and documentable change in the direction of the epidemic. Now, the reason we're emphasizing this, the reason we're going into this detail, is because after Christmas and after New Year's, our customary behavior is to have lots of gatherings as we move into the carnival season. And although the carnival festivities have been officially postponed, we're still aware that there's the tendency, the desire to have some small-scale events that can fill the gap. But we really want to advise against gatherings of that nature. We know that it is in our culture, we know it's in our nature to do this, but if we do lose the thread, if we do drop our guard and begin to participate in gatherings of that nature, whether they are parties on a beach, whether they are parties in a backyard, we are going to lose the gains that we have made in getting the levels of viral circulation in the population down to relatively small numbers at this point in time. So outdoor gatherings are no protection. That's the point we're trying to make with regard to the references that we've made, whether it's outdoor, indoor. If we have gatherings, if we exceed the recommended numbers of individuals, if we fail to maintain physical distancing, we are going to see changes in viral circulation in the population. We have at least two, and there are more, but at least two easily findable, easily referenceable, documented correlations between outdoor gathering behavior and the changes in an epidemic direction, and we don't want to establish that here. So this is taking an opportunity to remind the population of this at what would customarily be a gathering season, and to ask us to do exactly as the Minister has just asked, to hold the fort, to maintain the physical distancing, to maintain the mask wearing, maintain the hand hygiene, and maintain the avoidance of going to work or going into gatherings if you don't feel well. I'm going to turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. And now we go into the question and answer segment. Our panelists today are ready to field questions. Media representatives, a reminder, please state your name, the media house that you represent, and we ask for 2 brief questions at the same time. If we have additional time, of course, we will field more questions. We begin with questions from Guardian Media Limited, CNC3.
Hi, good morning, everyone. Rashad Khan, Guardian Media Limited. I'm hoping that someone on the panel there, I was hoping for CMO, but someone on the panel there would be able to comment on the death that occurred yesterday at the Port of Spain General Hospital, especially considering that the person would have contracted the virus while on the ward when an outbreak occurred. Is this the first time something like this has happened? What is being done with the patients who are there right now and even going forward? And my second question is concerning the second Sunday event that occurred, I believe was over this weekend gone here. There seems to be some contradiction in perceiving what happened or at that event. You know, the person, the artist in question, is saying no, that it wasn't a fete, it wasn't a party per se, you know, and hope that it could have even been a model event going forward for how artists could possibly have their shows and stuff. So I'm just wondering if you could comment on that.
Thank you. We go to Dr. Hines, I think, for response. I think this is best poised to him. Dr. Hines?
Okay, thank you, Ms. Alcantara. Thank you, Mr. Khan, for the question. Now, the information that we currently have at our disposal regarding the most recent fatality, which will be updated in our upcoming update at 4 p.m. today, is that there was an individual who had been previously admitted for pre-existing conditions, and that during the course of their illness and during the course of case investigations around pre-existing cases of COVID, their swab returned as a positive. Now, the issue is really one of ensuring that we are continuing the infection prevention and control and the general nursing standards of care that are in place, that have been well established, that are well put into the protocols of hospital care, to be satisfied or to be sure that the risk of having that sort of potential transmission of things within the hospital setting is minimized. While I do not have information that can verify whether this is the first or subsequent instance of possible transmission within the healthcare setting, we do need to be aware that because COVID-19 is a virus that can present with absolutely no symptoms, people can be relatively well, they can be presenting to the hospital for other conditions, for the management of other things, that there's always an underlying possibility that a person that is not even in the hospital, a person that's next to you at work, a person that's next to you on a bus, a person that's next to you in a restaurant, a person that's next to you just about anywhere, may be asymptomatic and also infected. So the emphasis in this situation is really on maintaining the existing well-practiced protocols around infection prevention and control that reduce and minimize the risk of spread the risk of spread of anything, including COVID-19, between one individual and another. And we are confident that those infection prevention and control protocols that have been established, that exist in documented guidelines that are then reinforced by the infection prevention and control staff at each hospital, that those are adequate and satisfactory to reduce risk to the greatest extent possible. Again, with any transmissible disease that has asymptomatic presentations, there's always that underlying possibility that someone may be infected and you don't know. So this is where caution within the healthcare system, with the IPC, outside the healthcare system, with the mask wearing, with the physical distancing, with the hygiene. That's why these are so important. That's why everybody needs to play a part, from the public to the hospital setting. And we're already aware of and confident in the protocols and procedures in the hospital setting to minimize risk in that setting. And we do, again, want to encourage the population to do their part with their broader and less stringent, but still important infection prevention and control behaviors. Now, while we don't have the details on what the planned model or the planned outcome and execution of the event in question, this is with respect to your second question, what that was supposed to be, we do know that certain principles need to be adhered to if we are having an event, if we're having whether it's a concert or a movie or wherever we go, because we're trying to maintain a balance between the industries that require people to come out and participate and the protection of the population. We have established certain protocols. Those protocols include the reducing or capping the occupancy of buildings, spacing out the individuals who are in attendance at a particular event, and having masks worn. It's the same thing the same sort of protocols that we apply to, for example, the church, the religious gathering setting. So while we don't want to prevent people from being able to participate in their various activities, once there's a breach in the adherence to all not just one or two, but all of the precautions, then there's going to be a risk of increased spread. So if we have people getting up and moving around when they're supposed to be maintaining their seating with the physical distancing, if we have removal of masks, if we have exceeding the capacity in a given building in a given setting, any of those is going to increase risk. And while I can't say whether any of those things in particular apply to this setting, we do want to encourage across the board that we don't breach those regulations which are in place for the protection of the public. So the important takeaway is, even in situations where people do go into buildings, occupy buildings for events, whether it's church, whether it's a concert, we don't advocate that any of these precautions be abandoned. We advocate that all of the precautions be applied in series, in parallel, whichever way you want to look at it, but all at the same time to ensure that we optimize the protection of participants in any of these sorts of activities. So I'll turn you back over to Ms. Alcantara.
Thank you very much, Dr. Hines. And we go now to TV6, please.
Good morning, everyone. Urvashi from TV6. Dr. Hines, I'm not sure if you would have gone through this question already, so forgive me if you would have. Can we screen for the new strains of the virus, that's the 501Y and the D614G? And do you have any update? I think they were doing research on the strains present in Trinidad. Do you have an update on that? My second question relates to the repatriation of citizens. Persons confirmed with the virus in Trinidad and Tobago are allowed to home quarantine. Is it possible to ease the burden on such facilities that persons who are being repatriated, given that they would have presented one, sometimes two negative PCR tests, is it possible for them to quarantine at home as well?
Thank you very much. I think, Dr. Hines, you want to take the first question?
Yes. Okay, so thank you for the question. In fact, the first question was two questions. The first question was, can we screen? And the second bit of the question was whether there was any update on the UE research. The answer to the first question is yes. The PCR testing that we do have is able to detect COVID-19, and whether it's the old or the new strain, the PCR testing is still able to do that detection because it is identifying parts of the DNA that are still identifiable using the primers and the materials that already exist. So that has not impaired the ability of the test to detect the virus, even if it is the new strain. Now, the work that has been done by the UE in conjunction with the Ministry of Health, with CPHL, that has not, up to this point, detected or discovered any cases, any samples with that new strain of the virus. So it's ongoing, continuing to monitor, but no cases of that new strain of the virus have yet been detected. And while I will allow Dr. Richards to continue the answer to this question, I want to start to respond to the second question by indicating that at this point, when we are doing our utmost to prevent the introduction of the new strain of a virus that can present with asymptomatic, basically can present asymptomatically, it's not really the ideal or opportune time to look at reducing the stringency of screening and containment as people come into the country. So from an epidemiologic perspective, from a scientific perspective, that's not the direction that you would want to contemplate going in at a point in time when the importance of keeping new strains of the virus out of the population is uppermost in our minds. I'm going to turn you back over to Dr. Richards and to Ms. Alcantara.
Yeah, we'll actually go to Minister first and then to Dr. Richards, I believe.
Thank you. I just wanted to further explain, and thank you, Urvashi, for the question. That issue was addressed at last week's Wednesday press conference in some detail, but I think it's worth repeating, and I thank you for raising it again. Let me explain how that UE, CARPHA, Ministry of Health program works as far as screening for the new variants, either the South African variant or the UK variant. The Ministries of Health in the CARICOM region under the guidance of CARPHA, will send samples of persons who have been swabbed to CARPHA. CARPHA in turn sends the samples to UWI St. Augustine because they procured the necessary equipment last year, yes, to do the genomic sequencing. So let me explain how it works. It's a screen. It doesn't mean we are testing every single sample. What we do under the direction of CARPHA is pick a certain number of samples, not from the general population resident in Trinidad and Tobago, but samples with a certain viral load. They have to meet a certain threshold of repatriated persons who have tested positive. So in order to zero in on whether the South African variant or the UK variant is here, you don't test your resident population. You take samples of the repatriated individuals that have a certain threshold of viral load. Those samples are sent to CARPHA. They are the collection point for the CARICOM, and then sent to UWI. It was via that process that UWI St. Augustine, working in tandem with CARPHA, was able to identify a couple of weeks ago that Jamaica did in fact have the strain. It's a screen. So it doesn't mean that the UK variant is not here. It is quite possible that it is here, as we have said on this platform many times. It is quite possible. But it's a further screen to alert us as to whether these new variants have in fact been picked up from our repatriated individuals. So I'm thankful for the second opportunity to give the policy perspective on how that program is working. Dr. Richards.
Thank you, Minister, and thank you, Urvashi. The controlled or regulated inward movement of repatriated nationals and other persons is part of the government of the Republic of Trinidad and Tobago's response to the national COVID-19 to the COVID-19 pandemic. At present, as per the Ministry of Health's policy on returning nationals and persons entering Trinidad and Tobago, persons from high and medium risk countries currently undergo 7 days of state or state-supervised quarantine, followed by 7 days at home. Persons from low-risk countries are allowed to home quarantine for a period of 14 days with monitoring by the relevant county medical officer of health. Now, the decision to allow persons or to decide what is a low and medium risk country versus a high-risk country really falls with the WHO's epidemiological situational report, which the Ministry of Health consults on a weekly basis to identify countries based on the transmission levels. At present, we do have certain persons who are allowed to home quarantine in spite of a positive COVID test. However, I must make it clear that the decision to home quarantine is not merely based on the positive test, but on clinical indicators, that is the clinical condition of the patient, if the patient has any other coexisting diseases that put them at risk of deterioration, and socioeconomic conditions. So, for example, if a person who has tested positive indicates that they are unable to self-isolate at home, or they may have at-risk relatives, they are offered to basically be self-isolated in a step-down facility. The Ministry of Health, again with the government, is concerned about the introduction of the new strain amongst repatriated nationals. And so the condition that is currently identified in the policy really states that persons need to have 7 days of containment with regular monitoring by the Ministry of Health, especially in terms of the County Medical Officer of Health. So I hope that my response has clarified the basis for allowing persons to home quarantine who are positive and the criteria, as well as the reasons for containment or self-quarantine of returning nationals in state or state-supervised facilities. Thank you.
Thank you very much for those responses. And we go now to Wired 868, please.
Hi, good morning, everyone. Fiola Bostic from Wired 868. I really just have one question today. Last year, the WHO said that the virus is likely to stay with us, much like HIV and measles and other diseases that we've had to learn to live with. Given at some point borders will eventually have to open, schools we imagine will eventually have to open as well, and certain restrictions will have to be lifted. What strategies are we looking forward to in the future for how we're going to control the spread of the virus after these lockdown and other restrictions have lifted?
Okay, so I will start off the answer. Let me say there is no lockdown in Trinidad and Tobago. That is a term that some members of the media like to use. There is no lockdown. There is no state of emergency. There is no curfew. Everyone has their constitutional rights and freedoms preserved from day one, as opposed to many countries near and far. There is no lockdown. The economy is open. Construction, which was closed, is open. Manufacturing, which was closed in the early lockdown, is open. Dining is open at 50%. Casinos are open. Civil service is back out. So I just want to reiterate, there is no lockdown. Okay, so the strategies moving forward will have to be a combination of the current measures and two, for the foreseeable future for 2021, the vaccination program. And the vaccination program, as we have seen, the vaccines prevent a lot of serious illness and hospitalization. As more and more evidence comes in during the course of 2021, then determinations will have to be made how we live with this virus post the vaccinations. But in the short to medium term, and Dr. Hines could then come in now, the measures that all countries around the world are looking at right now is the vaccination program. Dr. Hines, you want to add anything?
Minister, I believe you covered the most important part of the strategy, so I don't have anything to add to that part of the answer.
Thank you very much. We go now to IETV, please.
Hi, good morning, everyone.
Morning.
I have two quick questions. My first question would go to the Health Minister. Minister Nurses, the Nurses Association last week, they are calling for mandatory testing for all patients who are to be warded at the public hospitals, meaning the Port of Spain General Hospital and all other public hospitals. Any considerations being given to this, especially after the latest death? And my second question would go to Dr. Richards. Dr. Richards, last week you said one of your concerns when it comes to the variants possibly reaching our shores would be bed space in the parallel healthcare system. So the same way measures are being implemented to receive the vaccine when it arrives in our shores, is there any measures in place for additional beds, or would the current system and the current bed space be utilized and expanded? Thank you.
Okay, so thank you for the question. So at last week's press conference, this question was about mandatory testing, was posed to the Chief Medical Officer. And if I remember correctly, the Chief Medical Officer says mandatory testing is not required nor feasible or desirable at this point in time. I think he answered that in some detail, and that has been borne out by the science all around the world. Thank you very much, Dr. Richards.
Okay, thank you. So the parallel healthcare system currently comprises of about 25 facilities with an approximate bed occupancy or bed capacity, of 1,741 beds. At present, we have 7 hospitals, 5 in Trinidad and 2 in Tobago, with an ambulatory capacity of approximately 441 beds, ICU capacity of 38 beds, and an HDU capacity of 57 beds. Our occupancy rates thus far over the last 12 weeks or so at each level have been quite low, and we've noted a downward trend in terms of the occupancy rates. So, for example, the ambulatory or ward level beds, the capacity has been wavering between 8% and 16 to 18%, while the ICU capacity has been between 4% and 15 or 16%, and the HDU capacity has been between 0%, especially over the last few days, and 16%. Now, with regards to your question about measures to increase the capacity of the parallel healthcare system, at present, given the occupancy rates, we believe that there is enough space, or there are enough beds and associated resources. If for some reason we need to increase the number of ICU beds, we do have ventilators and associated human resource and other factors that we consider to actually increase or double the number of ICU bed spaces. HDU bed spaces can basically be there's a level of interoperability between ICU and HDU beds. And additionally, we have at present about 15 quarantine facilities, of which about 5 of them can be converted into step-down facilities. So in summary, there are several measures, including the number of beds that are available at the hospitals, because obviously in the parallel healthcare system, the limiting factor would be bed spaces for ill patients, as well as the level of interoperability that exists for quarantine centers versus step-down centers. Thank you.
Let me just expand on that answer. As Minister of Health, let me take the public and the media into my thoughts, which I have shared with the CEOs, and everyone is in agreement. If we continue to adhere to the public health measures, and we continue to maintain these steady numbers from October, we have already planned, if these numbers hold, I want my comments to be carried properly. If these numbers hold, instead of talking about expanding hospital space, we are now thinking and have a plan to take the Arima Hospital out of the COVID grid. Because the Arima Hospital, where we are keeping our suspect cases, is grossly underutilized. You have about 5 or 10 persons there on any one day in a 100-bed facility. So our current thinking, if the numbers hold, is to return the Arima Hospital, which has never been used for the benefit of the people of Arima, La Hoquita, Sangre Grande, all those areas, Samaru Village, to its original use, which is a secondary health facility. We have a plan, once the numbers hold, that by February, once we get over the Christmas spike, which we expect, the Old Year spike, if we conduct ourselves properly over what is this virtual carnival period, the Arima Hospital can be taken offline and be returned to the people of Arima for its original purpose. That is one of the prizes we have in the healthcare system, but we must have those numbers. What we are thinking about doing is suspect cases will find a home at the Augustus Long Hospital, again, which is underutilized. We are paying a visit to the Augustus Long facility next week, Tuesday, to see if physically and logistically that can happen. So that is another prize we can look forward to take Arima off the COVID grid and return it to its original purpose to serve Arima and its environs. Thank you very much.
Thank you much. And we go now to some of the public questions that have come into us. We go to the first question. This is a very question that we get quite a lot. Can we trust the COVID-19 vaccine since it was developed so quickly? Dr. Hines, I think you're the best person to tackle this one.
Yes, I agree.
Okay, thank you. No, I think, honestly, the best person to tackle it is the person who has tackled it and who has given this information before in the person of our geneticist and UE counterpart, Professor Carrington. But to mirror and to repeat, to reiterate what she has said and what also the head of the PAHO WHO office in Trinidad has said, the vaccine, while it seems to have been developed quickly, has had a head start because it has actually been in research and development. Coronavirus vaccines have been in research and development for the period of time when SARS, that's the severe acute respiratory syndrome, in 2003, MERS in 2013, when those were in circulation, the additional funding that was made available to the research process then allowed all of the research to be done with the existing approved rigor, the care to detail that's needed for testing a vaccine, but to be done in a shorter time because the funding is available and because the whole world is really focused on getting this resource out as quickly as possible. So the process for approving the vaccines has not been short-circuited in any way. The safety measurements, the safety observations have been conducted. Remember, we have had this vaccine, the information on the genetics of the vaccine since January, and the information on how to make vaccines of this type for several years before. So it only looks short, but the actual process has not been short-circuited. And the confirmation of the safety by all the clinical trials has indicated that the vaccine has a good safety profile. The ones that are currently under consideration have good safety profiles, and we can trust them.
Thank you, Dr. Hines. So we had a head start of sorts. The second question now, and we use the term shots here. How many shots of the COVID-19 vaccine will I have to take? Dr. Hines, I think this one is for you again.
Shots or jabs?
Shots,
yes, well,
jabs.
The British use jabs. We use shots. I think the US uses shots. It really depends on the vaccine, but the current candidates under consideration are all two-phase vaccines, 2 shots. So there's either a space of 4 weeks or 2 weeks, depending on the candidate, between one injection and the next. But so far, it looks like it will be 2 for whichever vaccine comes our way.
Just to complete the answer, there is one vaccine in phase 3, but not yet approved for even emergency use authorization. That's the Johnson & Johnson Janssen candidate, which is a 1 shot, 1 jab, 1 choke. So that just to finish off the answer, but so far the vaccines that have been approved for emergency use authorization are 2 shots, 2 jabs.
Thank you, and Minister localized it there. 2 chooks.
Yes.
Our third question, and we have tackled this in various ways, but we will repeat to make sure that persons understand. Question 3. Can I stop wearing a mask and social distancing after I have received the COVID-19 vaccine? Dr. Richards, would you like to take this one?
Thank you, Candice. So the short answer to this question is no. The vaccine is part of an overall toolkit to prevent persons from contracting COVID-19. And this virus will be with us for some time. So as such, we would have to ask members of the population to continue to exercise the responsibility to keep our families safe, our neighbors, our school children, and the elderly. And these measures, which Minister had summarized very early on in the presentation, include the appropriate wearing of face masks, hand washing and sanitization of objects such as your laptop and your phone, etc., and social distancing and the avoidance of congregations as necessary. So thank you.
Okay, thank you. We go back to our media questions. AZP News, please. 2 brief questions.
Hi, good morning. Priya Bihari, azpnews.com. My first question is to Minister Dayal Singh. Minister, do we have an overall figure how much it will cost to vaccinate the entire population with everything in total? And my second question is to Dr. Richards. Dr. Richards, at the beginning, you spoke about that the ministry gives exemptions of for 130 people at a time. Is that per cycle? And meaning, is it every 7 days, or is this every 14 days? And could the ministry expand to get more of those people in at this present time? Thank you.
Thank you for the question, Priya. But before I answer, I have to ask you a question. Have you gotten your seasonal flu vaccination as yet, Priya?
Yes, I did.
Ah, lovely. Well
yes,
done. Okay, good. You're my friend again. Okay. On the cost to vaccinate the entire population. So there is no plan to vaccinate the entire population. As we have said, the phase 1 of this program is to vaccinate healthcare workers who are at high risk and the elderly over 60 in long stay homes. Then we go to those with comorbidities. No country in the world right now, to the best of my knowledge, under COVAX, has a plan to vaccinate the entire population. So that's one. Two, there can be no cost for Trinidad and Tobago yet because there is no vaccine approved under COVAX or via the bilateral talks that we are having that has indicated what a cost of a shot of the vaccine is as yet. So until we have the actual cost details, we can't estimate. As soon as we have that, it is my intention, as I have stated, to take a note to Cabinet, to inform Cabinet what is the cost implications and what is the process for vaccinations. But we are still waiting via both COVAX and the bilateral talks for our needs estimates. We have told them what we need, but no one yet has given us a cost estimate, right? Thank you very much.
Thank you very much. Newsday, we're ready for your questions now, please. Oh, I'm sorry. I think we forgot to go to Dr. Richards. Yeah. My apologies. We forgot to go to Dr. Richards for the second response. Dr. Richards?
Thanks, Priya, for your question on the repatriation process. Firstly, I would like to emphasize that the approval to enter Trinidad and Tobago falls under the purview of the Ministry of National Security. Arrangements thereafter, once persons are entering with respect to quarantine facilities, testing, the availability of human resources, monitoring and surveillance, as well as the logistics and ground transfers, fall under the Ministry of Health. So your question was in terms of the numbers of persons who are granted exemptions and whether it was a per cycle or a per flight basis. Now, the Ministry of National Security identifies the countries where there are the most returning nationals or persons requesting repatriations. And thus far, we've identified the US, Miami, and New York City, Canada, and Barbados, since Barbados seems to be a transfer point for persons who are coming in from Europe. The number of persons per flight or approvals granted is approximately 130 persons, and that is per flight. Additionally, the arrangements with the Ministry of Health in terms of improving that cycle or increasing that cycle, which was initially a 10-day cycle, because we have taken the 7-day quarantine process plus a 3-day turnaround at the particular facilities in determining the cycle, we've actually cut it down to somewhere between 7 and 8 days. The decision to increase the number of repatriated nationals is based on the overall occupancy of the parallel healthcare system and other factors such as the transmission rate of the virus in this country. So in short, we are at 130 per flight with a cycle now coming down from 10 days to 8 to 9 days. Thank you.
Thank you, Dr. Richards. And Newsday, we're ready for you now.
Good morning, Narissa Fraser from the Newsday. So the first question, I know that the TTFA would have recently indicated they may need back the home of football as the World Cup and World Cup qualifiers.
Having some background info.
That to the ministry?
We seem to be having some background noise coming through. I don't know if there's anyone around you. We're having a little trouble understanding your question. Right, so let's go again. I think we should be clear now. Newsday, please go ahead.
Right, I was asking about the home of football. The TTFA would have recently indicated they may need it back as World Cup and Gold Cup qualifiers are approaching. I wanted to know if this was communicated to the ministry as yet and if they're looking at a replacement step-down facility to be used. And the second question, I know Dr. Richards, you mentioned a repatriation flight from Canada should be coming in. Is that solely for the farm workers or does it include nationals who are not farm workers? Thanks.
Okay, so I will address the issue of home of football. No, I have had no formal correspondence from TTFA. I have noted the comments in the media at our pre-press conference meeting this morning, and Dr. Richards could tell you that this is absolutely true. She is meeting, and also our disaster management unit is meeting with me at 1:30, together with the permanent secretary and the chief medical officer, to do a total review of our parallel healthcare systems in terms of capacity in case we have to take home of football out of the grid. So that meeting is carded for 1:30 today, and after that we should have some sort of response.
As per the question, in terms of repatriated persons from Canada, we have two separate flights. One would be for returning nationals and repatriates, and another flight that is exclusive to the farm workers. Thank you.
Thank you very much, Dr. Richards. And we go quickly to follow-up question. A follow-up question now from CNC3, Guardian Media Limited, please.
Okay, hi. Thank you again. Minister, so you just mentioned that if numbers hold, that we could see the ARIMA facility come out of the parallel healthcare system. But at the beginning of the pandemic, the entire repatriation process has been stated by yourself as well as the Minister of National Security to be based on the capabilities to quarantine people when we are letting them in case there is any large spike in cases. So why take a facility out of the system and not convert it into a quarantine facility to allow more nationals to come back? You know, because there are various reasons why nationals may need to leave the country and even come back in.
Okay, so Richard, the parallel healthcare system consists of two arms. The hospital arm to treat ill people, suspect people, and the quarantine and step-down arm. We have never, in the history of this pandemic, quarantined returning nationals in any of the hospital facilities, whether it's ARIMA, CORA, CUVA, or Augustus Long. So if we take ARIMA out, it has no negative consequence on quarantine facilities for repatriated nationals. So let me repeat, we have never quarantined returning nationals in the hospital system of the parallel healthcare system. That has always been reserved. In the case of ARIMA, which never housed any repatriated national, ARIMA was always used for suspect cases from all the RHAs. What I have said, if the numbers continue to be steady, we will take ARIMA out of that part of the parallel healthcare system and utilize Augustus Long more fully and return ARIMA to service the health needs of ARIMA and environs. So I hope that lends some more clarity. Let me just repeat, we never use the hospital arm of the parallel healthcare system to quarantine repatriated nationals. So taking ARIMA out will have no negative consequence on that particular issue you have raised. But thank you for raising it.
Thank you, Minister. And the final question today comes from TV6.
Thank you. Dr. Hines, I'm just kind of curious, as it relates to your epidemiological analysis, how was the epidemiology unit able to associate the Christmas activity, Old Year's activity, last lap activity with results on spikes, but there was no connection made between an even larger event, for instance, the election, and any spike? Thank you.
Thank you for the question. I'm not sure at which point we missed the several repeated indications, even before the spike in August, that the gathering activities that were noticed in the early August period were related to the predicted and subsequent noted increase in cases. Anytime there's a gathering, regardless of the reason for the gathering, we note that there will be an increase in cases if we have mass gatherings in the population. We alluded to it before it happened in August. We alluded to it after it happened around a last lap activity. We alluded to the possibility of it happening if we did not adhere to the guidelines, to the recommendations not to gather over the Christmas, over the New Year period. And we continue to allude to the potential risk for increases in transmission of illness anytime there is the tendency towards mass gathering. So we are now emphasizing that message with respect to potential gatherings in the carnival season. So there's no point at which we did not link or make the association between gatherings of various sizes and the potential changes or the historical changes in the transmission of disease. If you'd like, you can go back to August 12th media conference and review exactly what was said at that point in time, and continue to review the rest of the statements made thereafter with respect to large gatherings, inadvisable behavior, and the consequences on disease transmission. It's been a consistent message, but thank you for allowing me to reiterate.
Thank you very much, Dr. Hines. We have come to the end of today's media conference, and we all received some words of encouragement today, and we were urged to push past pandemic fatigue and to keep doing what we know we should be doing, acting responsibly. We are reminded especially, again, the consistent message: avoid gatherings where possible, not just in public, but in homes as well, and we must follow all of the guidelines. Trinidad and Tobago, let us stay the course, be safe, and of course, wear your mask.